Hi, and welcome to my channel, All Things BBL. And in case you don't know, a BBL surgery is short for Brazilian butt lift, and that's where they take all the fat from your stomach and your back, and they put it in your butt. So in today's video, I'm gonna take you along on my surgery vlog where I show you pre-op, post-op, and a little bit of the aftercare. I'll be hopping in and out of this video explaining some of the clips. Hope you enjoy. In here filling out all the paperwork. It's a lot. Whoa, signing my life away. The office is very beautiful and I'm so excited. I can't wait. So this is the night before surgery. I like to sleep in my comfy zip down robe, which I was gonna wear to the surgery, but it's not long enough. It's a little, I don't know, I want something that comes down a little longer. So hopefully in a few hours, I'll have a bigger booty that you can actually see. In this clip, this is my surgery day, which was May 25th, 2021. My surgery time, well, the time I had to be at the clinic was 4:30 a.m. And they usually want you there 2 to 3 hours before the actual surgery. So I was there at 4:30 a.m. The first thing they do is they test your urine, and they're testing it for pregnancy and for drugs. And then after that, the nurse goes through your vitals. And then you get a chance to meet the doctor for the first time to go over what you want, what you don't want. Dr. Fisher, who's my doctor, he actually does take wish pics. So I gave him some wish pics to tell him how I want to look. I actually said I want a stripper booty. I don't want anything natural looking. Make it as big as possible. And so he was very excited about that, but he did look at my frame and he said, I'm very narrow. I'm actually 5'7" and I was 166 at time of surgery. But he said, he did say my frame is very narrow and the skin on my butt was very tight. So he was worried about how much fat he could actually put in. So he wasn't gonna promise me a big stripper booty, but he said it would look plump. And so then after I met with the doctor and we go through all my wants, then the anesthesiologist comes in, asks me a few questions, and then I actually walk into the surgery room, which was new for me because I've had many surgeries and usually I'm rolled into the surgery room, and usually by then I'm so on so much medication, I guess they give you volume or something, that I'm not knowing where I am. But for this time, you actually walk into the surgery room and you get strapped in, and then they insert the anesthesia into your IV. You feel like a burning sensation, and then that's it. You're knocked out. You don't remember anything. Just waiting to see the doctor. I'm ready for surgery. Whoa. I'm excited. Everything, I woke up on my stomach and I was in my surgical garment, which is called a faja. So that was fine waking up. I wasn't in excruciating pain waking up. Again, I just felt so numb, I guess, because the anesthesia was still in me. And I actually bought to the surgery center, I bought some water and I bought Tylenol. So as soon as I woke up in the recovery room, I took the Tylenol, and just so I wouldn't have to feel any pain or discomfort. Everything else was a little hazy after that. Like, I don't remember what the recovery room looked like. I don't remember if I was sitting or laying down next to anyone. I don't even remember getting wheeled out. They actually wheelchair you out to the person who's coming to pick you up. I don't remember getting wheeled out. I just remember getting in the car of my private nursing company. And I was actually able to get into the car again fairly well, considering I just came from surgery. I thought I was going to be in so much more pain. I was able to, step on the step stool, use my hands and my shoulders to prop myself up on the air mattress and to slowly lay down. Again, I was so tired and so drugged up that I wasn't in that much pain. So the surgery day, it was very uneventful, which is a good thing. And here's a clip of me on the day of surgery. This was actually maybe 3 to 4 hours after I got out of surgery, I was back at my hotel with my private nurse, and I was just checking out my results for the first time. As you'll notice, I'm covered in what looks like blood, but the doctor says it's actually fluids and it's not really all blood. But I wasn't in that much pain. I was expecting a lot more pain. What you actually feel, or what I felt, was stiffness. I was just very stiff, specifically in my lower butt area. It just felt so overstuffed. So it felt like my lower butt area was about to cramp, or like I did a ton of squats. But my back and my stomach, where they took the fat out of, that was very numb, so I wasn't feeling any pain there. Again, it was just stiffness, and I was feeling very nauseous from the anesthesia. I'm getting my walks in. I had surgery about 5 hours ago. Trying to walk every 10 minutes. Ooh, booty, and a lot of booty and blood. Pain is tolerable. I just feel sore, not really pain, and my butt feels very tight, almost to the point like I'm gonna have a Charlie horse or something on the bottom part. I don't have much of an appetite. A little nauseous feeling, but I have my nurse here. She's amazing, from StayRN, doing such a great job. I don't know what I would do without them. So in this clip, this is actually day 1 post-op. This is the first day that I'm going to the clinic to get my first massage. And this is the way I was transported. Again, I used a private nursing service, so they transported me to my first post-op appointment. And here I am, I'm laying actually on an air mattress in the back of like a minivan. And what I found useful was they also had a step stool for me to get into the car to lay on the air mattress. So the whole production of getting in the car, it wasn't that bad, and that step stool was a lifesaver. On my way to get my massage. This is day 1 post-op, laying in the back. It's nice and comfortable. Here at the surgery center, I have to wait until my appointment time to go in. With the new COVID restrictions, you can't go in until the appointment time. I'm hoping it's an easy one. I get out of breath so easily just walking to the elevator. I'm excited though. Check back in with you guys later. So after my first massage, I was so nervous about getting a massage because I did watch a lot of other YouTube vloggers, and I saw that all of them had just a horrible experience with the massages, how painful they were. Some people were crying. So I definitely went into this expecting the worst. But my first massage actually wasn't that bad. As I said before, my stomach and my back, they were very numb. So during the massage, I didn't feel any discomfort. The only discomfort that I might have felt was when they touched my sides a little bit. But again, everything felt so numb to me that I didn't feel anything. So especially during my back massage, I was able just to lay there and relax. Now, when the masseuse got to my front, I had to stand up. And the only discomfort I had during that part of the massage was when she went to massage the lower part of my stomach. And at the lower part of my stomach is where there were drains hanging out. Well, it's one drain hanging out. So that area is still very sensitive. So when she pushed on that, there was like a burning sensation, but again, it wasn't pain and it didn't last long. So I would have to say my first massage was pretty great. And I think another thing that made my massages easier was every time I got my massage, especially on this first day, a half an hour before I went, I made sure to take my pain medication, and I also ate a little something, and I made sure I was very well hydrated. The pain medication that I had were oxys, so again, the oxys numbed me up. I was already numb, so I think that helped with making my massages feel comfortable. So in this clip, this is day 2 post-op, and I'm actually in the doctor's office waiting to get my second massage, and you'll see how I'm not sitting because, you know, you're not allowed to sit after this type of surgery. So I'm actually just on my knees on a couch facing the wall waiting for my second massage. Day 2 post-op in the waiting room, waiting for my second massage. Feeling much better. I just hope my massage isn't too painful. Now my second massage, I thought that might be worse, maybe because the first day I was still so drugged up from the anesthesia. So again, I was anticipating the worst, but my second massage went just as great as the first one. I didn't feel any pain or discomfort, not even discomfort, just I didn't feel anything. Again, because I was so very numb. So that's how the rest of my massages, which the package that I got, it comes with 5 massages. So all of my 5 massages, they were very relaxing. No pain, just a slight discomfort when they touch my sides or the lower area where the drain was. And then after I got my 5th massage was the day that I also got my drain removed. And the drain removal also, that experience was so quick and I didn't feel anything. Right before they took the drain out, again, the drain is located in my lower stomach area, and it's like a long tube with a little bowl on the end of it. And so as they're getting ready to take it out, the lady says, count to 3 and hold your breath. And she pulled and it came out. But again, my lower stomach was so numb, I didn't feel anything, which was good. I'm not sure if it's normal to feel so numb. This was day 6 when I got the drain out, but I felt so numb, I didn't feel any pain with the drain removal. And again, it's a very quick process to remove the drain. It takes about 2 seconds and it's over. Well, here's the new body. We've got the front. My hips are going away. I told them to fill in the hip dips, but this is 3 weeks post-op and I can tell they already went down. At the side, and you got the back. Woo-hoo. Overall, I'm happy at 3 weeks. My stomach is getting flatter every day. I hope the butt stays plump. But overall, I'm pretty happy. Well, that's the end of the video. Thanks so much for watching. Make sure you check out the links in the description below. I leave links for my doctor and for the private nurse that I use. And also, feel free to drop a question in the comments section. If I get enough interest, I'll actually do a Q&A video. And of course, make sure to subscribe.